Hello, my name is Dr. Brian Reed, and I'm a naturopathic doctor. And this is a video about the utility of ozone therapy in patients who are suffering from chronic infections. Ozone is very near and dear to my heart. I've been using it in practice for about 7 or 8 years now. Definitely big props and thank you to Dr. Dietrich Klinghardt for bringing it to my attention, and then certainly to Dr. Frank Schallenberger for teaching ozone for so long, and he taught me my first ozone course, and over the course of time, ozone's just become a huge part of my practice, actually to the point where I've done so much of it. I a few years ago started teaching an ozone therapy certification course, which is one of the only approved courses for ozone certification in Canada. So with ozone, it can be used in patients suffering from chronic infections in a few different ways. The way that I'd like to talk about it today, though, is using it as a treatment for joints that are affected by infection, or at least suspected to be affected by infection. Borrelia in particular, the Lyme disease causing bacteria, has a strong affinity or a high affinity for joints. It loves to hang out in there. To my understanding, that's because it is always hungry for the trace mineral manganese, which is present in high concentrations in our connective tissue, which our joints have a decent amount of that. And then joints are also just a really good hiding place because we don't have a direct immune system infiltration of our joints, to my understanding. So it's just easier for the microbes to kind of evade the immune system and maybe other agents that we're using to try to kill the little critters. So the long and short of it is that using ozone therapy is a method that I've used in my practice many times to, as I like to explain it to patients, fumigate the joint. Ozone is a gas. Of course, we're using medical grade oxygen made from 100% medical grade oxygen and using a medical grade ozone generator. And then we actually literally inject that ozone gas into the joints of the patient in those joints that are affected. The process that I use is basically finding out which joints are bothering the patient the most, and then injecting with a fairly high strength of ozone, and then seeing how the patient feels afterwards. And what I've seen many times in my practice is when the dosage is right, when it's not too strong, and it's not too strong, just strong enough, if you will, not too low, not too strong, it's just right, then the patient should feel better. Not only should that joint feel better, because ozone is anti-inflammatory and helps to promote tissue healing, but it's and it's analgesic as well, but it's also, I believe, working to help lower the infectious load in the patient's body. Or if it's more of a immune system mediated inflammatory issue happening with the joint, then the ozone should be helping with that, because ozone has an immunomodulating effect. So it's just so versatile. I just love the stuff. So the patient should feel better. And what I've had a few cases over the course of time where patients have been overall doing better. Energy's better, brain fog's better, muscle pain is better, random crazy neurological symptoms are doing better, but they have one or two or three joints that are still bothering them, and they still don't feel 100% better. Like, my energy is 75, 80% better, but I've kind of hit a plateau. And then despite, hammering away with our herbs or IVs or other antimicrobial agents, we're just not really easily able to get them quickly over that plateau, or they're just stuck there at that plateau. And so in those cases, what I have found a number of times is that if we inject those residual problematic joints that are suffering, still having symptoms, like still having pain there, if we inject them with ozone, then oftentimes we'll see that the joints get better, and then the other systemic symptoms get better too, which, to my mind, I can't prove it because nobody's studied it, but what I think it might be happening is that we're literally fumigating the joint, chasing microbes out into the open. There are some studies showing that ozone's able to get at microbes that are hiding out in biofilms, which could be a feature of a chronically affected or infected joint. And I think that it's potentially actually just literally chasing the microbes out into the open, and then the herbs and immune system and everything is just going to clobber those microbes, and it seems to be a way of finally purging those last dregs of infection out of a patient's body by fumigating the joint. So with using ozone, for any clinicians listening, you have to be quite mindful with the potency of ozone that you're working with. What I have found is that more of a standard potency of ozone that we'd use for orthopedic purposes is usually well tolerated, but not always strong enough. Usually we want to use closer to like a 50 gamma concentration to really get at those microbes. And sometimes if we build that up too quickly, we can induce a HERC, so you have to be a bit careful. I'm actually going to be presenting on this topic at the annual American Academy of Ozonotherapy conference coming up in May. And so if you can make it to that conference, please do, because it's always a good time and there's lots of good topics this year. If you can't make it, but you'd like to hear me yap about this, on a clinician level, they always put up their recordings after the event that you can purchase, and you can buy the whole conference, or you can just purchase individual recordings. And I've purchased them myself for years past, but I haven't been able to make it. And I think it's around $30 or so. So very inexpensive if you want to get those clinical pearls and tidbits. For me, I'll be talking about case studies and protocols and all of that stuff. So ozone therapy can be a very useful adjunct in some of these chronic infection cases. In a future video, I'll talk about using intravenous ozone therapy as an adjunct, which is something else that can be useful. And I will leave it there for now.